Kimmtrak injection is used to treat a certain type of cancer, uveal melanoma. Active ingredient Tebentafusp. Tebentafusp belongs to a class of drugs known as monoclonal antibodies. It works by slowing or stopping the growth of cancer cells. Indications. Kimmtrak is indicated as monotherapy for the treatment of human leukocyte antigen in adult patients with unresectable or metastatic uveal melanoma. How to use. The recommended dosage of Kimmtrak administered intravenously is 20 micrograms on day 1, 30 micrograms on day 8, 68 micrograms on day 15, 68 micrograms once every week thereafter. Treat patients until unacceptable toxicity or disease progression occur. Administer the first 3 infusions of Kimmtrak in an appropriate healthcare setting by intravenous infusion over 15 to 12 minutes. Monitor patients during the infusion and for at least 16 hours after the infusion is complete. If the patient does not experience grade 2 or worsening hypertension, require medical intervention, during or after the third infusion, administer subsequent doses in an appropriate ambulatory care setting, and monitor patients for a minimum of 30 minutes following each of this infusion. Contraindications. Hypersensitivity to the active substance or to any of the excipients. Warnings. Before using Tebentafusp, tell doctor pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor pharmacist a medical history. Side effects. Dry, itchy skin, loss of color in the skin, hair color changes, swelling or muscle joint pain may occur. If any of these effects last or get worse, tell doctor pharmacist promptly. Tell doctor right away if you have any serious side effects, including signs of liver problems such as nausea, vomiting that does not stop, loss of appetite, stomach, abdominal pain, yellowing eyes, skin, dark urine.